I'm Julie. Thank you everyone for coming. I'm going to talk quickly about one of COYOTE's programs about medical education. And so for the past few months, COYOTE has been putting together a series of continuing education programs. And there are a few different formats. There's this CMEs for physicians and CNEs for nurses and CEs for social workers that work in hospitals and clinics and healthcare settings. And basically, COYOTE has been putting together these trainings to bring some of the conversations that are happening here tonight and just things that we talk about among COYOTE members all the time to the healthcare field, because as has been mentioned, there are a lot of anti-trafficking trainings that are going on that are encouraging people to call the cops on patients that come in looking for services and talk about doing sex work, and that they should be immediately reported, that the cops should come into the ER if it's an ER setting, into the hospital, that this should be something reportable and reported, and that patients should not be informed of these policies. And so one of the biggest parts of this continuing education program is getting healthcare providers to sit with what their role is as a healthcare provider and what it's not, and basically that their role is to provide healthcare and meet someone where they're at, and their role is not to pass judgment, not to report someone, not to separate them from their children, from their support systems, from their work that allows them to support themselves as they see fit. And so some of the quotes and some of the statistics that are going into these trainings as well came from COYOTE's research that was conducted in 2017 nationwide. There were over 1,500 responses collected, and one of the sections was on health experiences in healthcare, experiences in HIV services specifically, but in healthcare more generally. And really a lot of what the participants talked about was not being able to show up to healthcare in the first place or be straightforward with their providers for fear of being reported, for fear of being judged and not receiving good services, and for fear of not just incompetent providers, but providers that were going to endanger their patients. And so we used a lot of these quotes and stats, and also have been working with St. James Infirmary in California, which is a sex worker founded and run clinic, to bring some of what they found and what works for them at their clinic to more of a broader audience and additional healthcare sites, because sex workers deserve to receive healthcare that does not further stigmatize them, that does not criminalize them, and healthcare providers need to be aware of how stigma and criminalization affect a lot of their patients, and that if they look to build trusting, ongoing relationships with their patients, then they might be able to provide much better care. So, thank you. If you have any questions or want to know more about these programs, I would love to talk. Thank you.